Good morning, everybody. This is Dan Spatz on behalf of the Dalles Area Chamber of Commerce. Welcome to the Dalles Chamber Community Affairs. Today is Thursday, July 23rd. The summer is going quickly. I hope it's going safely for everybody. Wildfires, let's keep our fingers crossed. It's bad out there. I am joined this morning on my Zoom call by my beautiful wife, Michelle. Michelle, will you introduce yourself and your reason for being here this morning?
I'm Michelle Spatz, and I am a proud member serving on the community board of Adventist Health Columbia Gorge. And I'm really excited about all the great things that are happening within our hospital and healthcare system here locally. And can't wait to hear what Jayme's going to share.
And that is a segue to our guest this morning, Jayme Thompson, CEO at Adventist Health Columbia Gorge. Sorry about that. Jayme, we'll proceed with round the table introductions and turn it over to you. Thank you for joining us.
Thank you.
I'm going to start with Mr. Bill Lennox this morning, and then I'm going to go to Corliss. Bill, take it away.
Good morning. I'm on the board of North Central Public Health, so this is going to be a nice, good meeting to get caught up on other health care organizations. Thank you.
Thank you, Bill. Corliss, and then we'll go to Trish.
Morning, everyone. Corliss Marsh here. I'm with Habitat for Humanity and the library and the senior center. I also have a connection with the hospital. I do some volunteer work there. And I just wanted to remind everyone that this Saturday at 11 is a celebration of life for Becky Bailey. So that's it.
Corliss, do you have the time and location? Do you recall that?
Yes, 11 o'clock at Bargeway.
Okay. Becky, longtime host for Community Affairs with Bill Lennox and so many other contributions to the community. Trish, and then we'll go to Scott McKay.
Good morning. I'm Trish Neal. I'm with Legal Shield. We help keep small legal problems from becoming expensive ones. And I'll put my contact information in the chat. Thank you.
Thank you, Trish. And the same for all contact information, event information in the chat, anything like that. So we have that recording as well. Scott, and then to Lee.
Good morning, everyone. I have to say it's always difficult when you have a conflict on funerals. So I may not make Becky's funeral because I'll be attending Ron Nelson's funeral, who's a longtime manager of the Children's Services Division here in the Dalles. So anyway, I'm a volunteer for Circles of Care. I'm on the advisory council for Salvation Army, and they're now taking donations for the Shop with a Hero, which occurs in the end of August when they take young children to police and sheriff's deputies, and those type of folks will take individuals, young children, into Fred Meyer to purchase stuff for the fall. And I get to see Jayme once in a while. I'm on the Patient Family Advisory Committee for the Adventist, and which is a pleasure to be on. Thank you.
Thank you, Scott. Thank you. Lee, and then we'll go to Commissioner Roger Nichols.
Lee Weinstein on the board of Oregon Public Broadcasting and Q Life. My wife was recently a patient at the hospital and had phenomenal care, and we're ever so grateful for your team, Jayme. Thank you.
Thank you, Lee. Roger, and then to Misa. Roger?
Thank you. I have many hats these days, including the original Wasco County Courthouse and the Discovery Center Board. Temporarily no longer on the Gorge Commission. Now that I am Wasco County Commissioner, there is actually a piece in the act says no elected or appointed official may be a member of the Gorge Commission, but I hope to rejoin it afterwards. I have my contact information is in there, and I'm drinking from a fire hose right now, so any help I can get from anybody is always welcome. And my connection to the hospital, I'm a recent patient and a very satisfied one, so thank you.
Roger, any specifics where we can assist with workload there? let us know. Email out. Thank you,
I'm not
Roger.
bashful. That will not be a problem.
All right. Thank you for taking that on. Misa, and then we will go to Vesta.
I'm Misa Olson with Vocational Rehabilitation. I serve on their business services team. I'm based in Central Oregon, but I cover the Gorge, Central Oregon, and most of Southern Oregon. So I can provide service to business to connect with some of our clients for, a talent pipeline, or if you have questions about accommodation in the workplace or even need disability etiquette training, I can provide all of those services at no cost.
Good to know, Misa. Thank you. And be sure to put contact information in chat as well. We will go to Vesta, and then we've been joined by Jennifer Griffith with One Community Health. Vesta, take it away.
Good morning. I'm retired, so I'm not really affiliated with most of things, but I like to tune into this meeting so that I kind of keep track of what's going on in my community. So thank you.
Thank you for doing so, Vesta. Jennifer, we'll turn it over to you for organizational updates.
I don't really have any updates to share. Just happy to join this morning. And Adventist is a great partner and collaborator of ours. So good to see you, Jayme.
Good morning.
All right. Thank you, Jennifer. Jayme, with that, I think we will turn it over to you, if that sounds okay.
Yeah.
And would you like questions during the presentation? Ask people to hold questions. How do you want to do that?
I am very casual. If you have a question, pop it in the chat, or is there a raise your hand function in this? I'm not used to it. So
There is. Yeah,
Okay.
under
Yeah.
React, that little heart at the bottom, it says React, and then you
Click on
I am fine with questions as I go. That is works
Alrighty.
perfectly for me. All right. Well, good morning, everybody. Jayme Thompson. I'm the Administrator and Operations Officer here at Adventist Health Columbia Gorge. I'll tell you a little bit about myself, and then I will talk through all happenings with the hospital and our health system here. So, as I said, I'm Jayme Thompson. I am a longtime community member and resident from Sherman County. Born and raised there, grew up on a wheat ranch with my family. Taught me a lot about work ethic, right? Being a farmer's daughter and driving wheat truck without brakes growing up. So I learned a lot. Went away to school. I went to school at Ashland down at Southern Oregon, where I got my bachelor's degree from OHSU, actually, in nursing. And then I moved to Portland and spent a couple of years at St. Vincent's Hospital in Portland and realized that I did not want to live in Portland and I wanted to be back serving my community. So I came back and immediately hired here at what was then Mid-Columbia Medical Center up in our ICU and worked night shift, day shift, went to the emergency department, got into leadership, had twin boys, got out of leadership. And then eventually got back into leadership after my kids got into the school age. And ever since then, I have been wanting to really lead this organization. I saw from my past experiences what worked well and what didn't. So my predecessors before me taught me a lot, like how to lead and how not to lead. So I then became chief nursing officer about 4 years ago and served in that role for a couple of years. And then 2 years ago, I was blessed with getting the administrator and operations officer role as folks transitioned out due to retirement. And it's been a privilege. It is truly a privilege. We have an amazing team here. Our leadership team, it's the best I can say it's ever been for this organization. We are all truly rooted and dedicated to this community and doing the right thing. Keeping our community core commitments first, focusing on patient care first, quality and safety first. And it's truly been a blessing to serve over the last 2 years in that role. Given my long history and roots within the community, This is a place that I want to continue to serve until they either boot me out, or hopefully that doesn't happen, or I retire. It's been a privilege. Some of our core focuses as I stepped in 2 years ago into the administrator role was really reshuffling and restructuring the culture of the organization, focusing on honesty and transparency, listening, bringing our staff members and our leaders to the executive table to have conversations of what works and what doesn't. They are truly the experts in the field. And so we've created this culture of just open communication and dialogue, which has really driven a lot of our results that we're seeing today. Another key focus, and Jennifer touched on it, is rebuilding our relationships with our community partners. It's really important. It was one of my soapbox points when I was interviewing for my position, how important it is in the Columbia Gorge to not compete for everything, but rather collaborate. What works for one community health, what works for us, what works for Prov Hood River, and coming together and figuring out how we can collaborate to improve healthcare in the Gorge and not be so competitive and trying to be number one. So we've done a really good job of mending those relationships, and I truly feel very lucky to have Jennifer Griffith and Rebecca at Providence Hood River, and even our friends over at Skyline and KVH, because together we are going to improve healthcare for the Columbia Gorge community as a whole. And so I'm very blessed with that. And then the other piece that I really focused on as I stepped into this role is diving in and being a part of the community. Being a part of the community events, the parades, the outreach, our SOMOS program. I feel in the past, Mid-Columbia Medical Center was not really a true community member. And so I really wanted to focus on getting out there, being a part of different boards. Every leader, every executive leader here on our team is a part of a board within the community. And that's really important because our voice matters, our community voice matters, and we need to represent for our community. So that's a little bit about me in the background and where we are and what my top focus areas were as I stepped into this role 2 years ago. I'll go through a few organizational updates. And again, please feel free to raise your hand or put some questions in the chat. So we are officially critical access hospital designation. We received confirmation from our friends at CMS just a couple weeks ago. It has been a 3-year process. We started this mission, this journey 3 years ago. We are the first hospital in the state of Oregon in over 30 years to become critical access. So we had nobody to really help understand and lead us down the path of all of the hoops and the things we had to accomplish to get critical access. It was quite the journey. I do have to put a plug in for Wendy Applin. She's our retired Chief Financial Officer. She started this 3 years ago. She wanted to retire last year and she stayed on per diem or a casual for us to get us across the finish line. And she did a lot of work behind the scenes for us. So in those 3 years, we had to go through our Healthcare Market Oversight Committee within the OHA, which is it's a regulatory committee. I won't get into the details. It was very difficult to manage through that, but we did. And then we had to apply with OHA to drop our license from 49 to 25 beds, which we did. And we officially became a 25-bed hospital in January. And then we had to go through multiple other steps, but the last few steps were Joint Commission, who is our accrediting agency, did our 2 surveys within 8 weeks. That's unheard of in healthcare. So we went through and successfully passed 2 Joint Commission surveys. And then the final blessing was from our CMS friends just 2 weeks ago. So we're very happy. This was a venture from Wendy and the executive team 3 years ago, really in full transparency to keep our doors open. Independent, small community hospitals that weren't critical access are struggling around the state, around the nation. 50% of the hospitals in Oregon right now are for sale. 50%. So, and it's not on realtor.com, you know, you can't see that information. So healthcare was really has been struggling for some time. COVID didn't help. So I'm very thankful our team 3 years ago started this journey to critical access. In addition, started the journey to become a partner with Adventist Health, and it's been a blessing. So that means we get to keep care local, this critical access designation. It doesn't change operationally how we manage our patients here. We have had an average daily census of anywhere from 17 to 20 for the last 10, 15 years. It doesn't change any of our operations within the hospital as far as nursing and physicians and care and the specialty care that we provide. The really only thing it does is align our operations with our accreditation. And it's truly what we needed to do for some time. We just, you know, took some time to get there. Things that there's different pieces, and it's very convoluted and sometimes hard to understand, but there's different types of admissions here in the hospital. There's an inpatient admission. Those are the patients that we know are going to stay for 2 or 3, 4 days. There's observation patients. Those patients we expect to just admit for 24 and 36 hours, and then they discharge home. There's day patients who say have surgery and they just need to stay 6 to 12 hours, and then they're going to be discharged home. The 25 bed for critical access is all inpatient. So those are the patients that we are expected to stay 3, 4, sometimes longer days. And that is the bed capacity that we have to stay under 25. We can have more than 25 patients in the hospital at a time. We just can't have more than 25 of those inpatient. And we've seen that over the last few weeks. We've been very busy. We've had a census of total bed census of anywhere from 25 to 30, but the inpatient census has to be and will always be under 25. Just a little critical access information there.
Jayme,
So what this, yeah, Michelle.
maybe you're going to talk about this, but can you talk about how if there's an emergency or a disaster, we can float up the number of beds?
Yeah, so if there is an emergency or disaster, we can apply for a waiver through the state that allows us, very similar to what we did in COVID. During COVID, we were allowed waivers that allowed us to go above our capacity in certain areas. So there is that flexibility there. I really hope we don't have another COVID situation or another emergency, but we can flex somewhat there. It has to be a state declared disaster. So that's where we are with critical access. The big thing for us, it doesn't change operations. What it really changes is our revenue cycle and our ability to bill. We get a different percentage of reimbursement with critical access, which we're working on the rev cycle side right now because all of our pieces for critical access have been done. We do not expect to see that come into play until 2027 because we submit a cost report and that's what it's based off of in 2027. So that's where we are with critical access. That's the truth and the reality of it. It's been a long, hard journey. There are certain things that we've had to make some decisions on with the cost report, that we've had to make some adjustments in order to optimize our ability to run critical access. So an example is our Great and Small Child Care Center is something that actually drops our reimbursement rate. It pulls down our cost-based reimbursement rate. Rather than close Great and Small, we have made it an employee benefit. So by allowing it being an employee benefit, it doesn't impact our cost report or our critical access status, and allows us to maintain that very important service to our employees here locally. So there's been.
I would have a fast question on that one, if you don't
Sure.
mind. Does that mean that Great and Small is no longer available for non-employees, community members in general? Okay.
Yeah, and that change was made last fall.
Okay.
So
Okay.
it's been in the works for some time. Our true reason for opening it 40 some years ago was as an employee benefit, and so we're keeping that core commitment there.
Certainly, certainly.
So yeah, I mean, critical access, the reality is if we wouldn't have got critical access here for this hospital, I wouldn't be sitting here probably. And we would have had to make some really, really hard decisions on the future of this organization. So this was a must, even though it's been hard and there's been some difficult decisions with it, but this is a must. And like I said, the executive team, myself, Adventist really wants to keep care local and keep the doors of this organization open. And so there was a big push for that, and we were successful. Any questions about critical access before I move on? Okay. Water's Edge. So today is the official day that all the clinics will be moved back into our Water's Edge building. Yes, hallelujah. So for those that don't remember, in December, we had our roof blew off of our Water's Edge building. Thankfully, again, we have amazing leadership teams and staff. We were able to stand up almost all the clinics within 3 or 4 days, all the clinics within 2 weeks. We've been in alternate locations for the last 6-7 months. Couple weeks ago, we were able to move our internal med group back down to Water's Edge, our sleep and our ENT clinics back down to Water's Edge. But today is the day they now get to move our orthopedic clinic into Water's Edge and our cardiology clinic back into Water's Edge. So very excited. We will be having a grand reopening. We haven't started planning it yet, but we are going to do a grand reopening for Water's Edge. It's been quite the, very similar to critical access. It's been quite the journey with Water's Edge and all the things that have had to happen. But we're getting there and we're reopening. Our long-term vision eventually in the future is to have all of our primary care locations at Water's Edge, allowing us to get out of the leased spaces that we are in various locations across the Dalles and even Hood River, and have our primary hub for primary care and clinics down at Water's Edge. And then, of course, our Celilo and MOB building here, up here by the hospital, and exit all the lease space. That's, again, another strategy, both financial and then also a commitment to a one-stop shop, basically, for our primary care and our specialty clinics. What's staying, our overnight sleep lab is staying up at the hospital. We did relocate it up here after the Water's Edge disaster. The reason for that is safety. We were performing sleep studies overnight in Water's Edge with one employee and multiple patients, and that's just not a safe situation. So we moved it up into our old rehab space here in the hospital. They have 24/7 response from our emergency team as needed, also our security, and it's just the best fit for our patients and staff. So we're keeping that up here. And then immediate care is staying at family medicine for now. We'll make the decision at some point to move it back to Water's Edge. The reason it's been going really well, having immediate care at family medicine, we've been able to see more patients per day with it being at family medicine because they're continuously shuffling and our family medicine physicians and APPs are opening additional spots throughout the day. If immediate care gets busy, they can slide in and see one of our family med doctors. So it's been really very successful. They're seeing anywhere from 25 to 40 patients a day in immediate care, which is fantastic. It's that access to care that we need to give our community. And it's not the emergency department, which is really great. It helps decompress that emergency department. So we're going to keep immediate care down at family medicine until further notice. And that's the plan. Any questions about Water's Edge?
Yeah, so Jayme, I do have a quick clarification. You said all, was it primary care going into Water's Edge and having that be the hub? But family medicine, is it staying where it's at, or is it eventually going to move to Water's Edge?
The goal is, 3 to 4, maybe even 5 years from now, we would like to have Water's Edge be our primary care hub. So moving all of primary care into Water's Edge is our long-term vision for that space.
Okay, got it.
Yeah, but for now it's staying at the family center.
Thanks.
Yeah. Another exciting thing is we have nothing to do around here is Epic. So we are transitioning our EMR, our medical record, over to Adventist Health Epic. We have been on OHSU version of Epic for 15 years. It's not working. OHSU Epic is a academic medicine Epic version, and we are moving to the Adventist Health version of Epic. All 27 hospitals were all going live August 30th. So say a prayer for us August 30th, because it's going to be a big bang situation here. It's not going to really change a lot for us as far as functionality. It's pretty much very similar to the OHSU Epic. The nice thing about it is Adventist Health has purchased all the AI options. So what that means for our community and our patients is more FaceTime with your nurse and your physician, because now they're going to have various tools that allow them to be more at the bedside and less on the computer documenting. I'm very excited about that. I think it's going to change our patient experience. It's going to change our efficiency and our satisfaction with our staff and physicians. It provides that more time with those patients directly and less staring at the computer. There's also going to be some online scheduling options for our patients in our community. So rather than have to call the clinics, there's availability through MyChart. They can actually schedule their own appointments, which will be fantastic. And then as far as MyChart for our community, it'll be the same login and same password. You'll just have to pick Adventist Health versus the OHSU. So they're working on some marketing and communications out to the community and our patients in regards to that and the change with my Epic or my chart access.
Jayme, you anticipated my question on my chart, and Roger had his hand up. Do you still have a question, Roger?
It's the MyChart question, because that has proved so valuable. We get nervous if somebody talks about changing it.
Will not for the user, it's not going to change anything other than the fact you probably, my understanding is, I haven't seen it, but my understanding is you have to pick Adventist Health versus OHSU when you're in MyChart.
So Jamie,
Yeah.
our current records on the current version will be brought over to the new one.
All of it will
Okay.
transition over. Yeah.
And I'm wondering, you know, there's a link from the hospital website to my chart. Wouldn't it link directly to the new version?
Yes.
Yeah, so
Yes.
it's our phone apps and stuff that we would need to update.
Your app should be the same. It's just when you log in, you'll now have an option to pick Adventist Health
Okay,
versus the OHSU one,
okay,
is my understanding.
all right. TBD.
TBD.
August 30th. August 30th. All right.
Yes, August 30th.
Well, one thing you didn't mention, Jamie, excuse me, is that this whole transition has been like super fast tracked. It usually takes what, like 1 to 2 years to make the transition or something crazy like that. And we're doing it in how many months?
Yeah, well, so for us, we started last year. So
Okay.
it has been a year.
Yeah. Okay.
It's been a year. For the executive team at Adventist Health in Roseville, they've been planning this for 2 or 3 years.
Yeah.
It is a lot different than the last time we transitioned because this is a system transition. So they're trying to manage 27 hospitals transitioning to this new Epic. So it's been interesting. And yes, it feels like it's coming fast and furious, and there's a lot happening with it. So, but as far as the user goes and the My Chart goes, it should be fairly simple and user friendly. I know they're working on some marketing and communication to go out to our patients. So be on the lookout for that. And then the future. I know I talked briefly about our vision for Water's Edge and being the primary care hub. You know, we really have focused on getting out of the extra lease space throughout the communities, even Hood River, so that we can focus on our core commitments here locally to our community. We've celebrated 125 years in June. We celebrated 125 years of the hospital and 25 years of Celilo. Those are really important accomplishments for us, and we can want to continue to be here for another 125 years. And then recruitment, focusing on, you know, our cancer care is super important here locally, and we are working very hard to get our medical oncologist on board, a permanent one. We've had some locums for in that area for the last 5 years. And so really focusing on medical oncology. We have a new orthopedic joint surgeon joining our team this next month in August. Dr. Giganti comes to us very ambitious, very dedicated to this community and has roots here. And I'm really excited to get him on board. He will be the orthopedic team. Actually, he won't be, but the orthopedic team will be at the upcoming car show, an event that is happening for, I'm assuming, Neon Nights. And so we're really focusing on our orthopedic team and Dr. Giganti coming. He'll be a great addition for us. And then our OB department and women's health, we've done a really great job of recruiting OBGYNs. We are fully staffed and have some great. Dr. Bump joined our team. Dr. Marcus Daisy joined our team, and they're both fantastic addition to Dr. Pentopoulos, who's been here forever and was pretty much doing it on her own for a long time. And our primary care is stable. Our specialty care is stable. I know Dr. Gingrich, longtime urology, is retiring before the go live with Epic. But we're working on recruiting another urologist because Dr. Mark McAllister is super busy. And so we're working on recruiting another urologist for our community. And then the other piece is we have applied, we're working through the rural health transformation dollars. We unfortunately didn't get the catalyst or the competitive award, but we're working with our rural health partners and OHA for the non-competitive awards, and hopefully we'll hear soon for that. That'll allow us to put in some money into some areas that we've neglected for some time, some capital things that we've decided to commit to for our community and the patients and our physicians and nurses here and staff. So we're working through that. And then we're continuously just thinking through how we can do things better and differently than we've done in the past. I know all of healthcare organizations throughout the country are really having to rethink what healthcare looks like and how to do it differently to provide better care for our patients in our community, but also allow us to be financially sustainable so that we can keep our doors open into the future. And so I know Jennifer's leading a team with healthcare in the Gorge to really rethink and reshift and shape what that looks like. And we're doing that locally here. So things are constantly changing and we're constantly rethinking how to do things. But we are committed to our core commitments, to our core responsibilities to this community. And we will always focus on patient care, and patient care comes with quality and safety of that patient care is always first. So that's where we are. I went through critical access, Water's Edge, Epic, and where we are into the future. And now, see, it's 7:37. So I will stop and allow people to ask questions. I'm always interested in rumors that they're hearing out there.
Roger, take it away. You have your hand up.
Thank you.
So,
I have some compliments and some really, really tough questions in my job as news person. So just want you to know this is not personal, but I want to scotch some rumors that are out there and get some actual fact on the ground. So compliments first, because that's always the best way to go. I can't say enough about Dr. Wong and the people at the Solano Cancer Center, where I've been recently treated for prostate cancer. I've never been so almost coddled, really, really carefully treated. And of course, Dr. McAllister. And last Friday, I had a colonoscopy, so Dr. Moon did a great job on that. So that's the good stuff. Now the tough stuff, and this is, I apologize again, but I do have to ask these.
that's okay.
When Adventist came, they made a very specific promise to give $100 million over 10 years. It's been 3 years. Where's the $30 million gone?
It's not 30 million.
That's a good question. Actually, it's more than 30 million that we've spent. The $100 million that they guaranteed us for capital has supported our operations. This organization has lost between $1.5 and $2.5 million month over month for the last 3 years. And so their $100 million that they guaranteed us for capital, yes, we've used a little bit here and there to do some improvements, but it has basically kept our doors open and supported our operations. So that is why the pressure is on for us here locally to stop the bleed of the hospital and allow us to support ourselves so that we can reinvest those dollars into the organization, our people, and our community. So unfortunately, the millions of dollars has gone to support operations in the organization.
Thank you. I wanted that out for the public because there have been questions.
Yeah.
A couple more.
Yeah.
One, Plane Tree. This was a very big deal way back when, and you talk about open and supporting patients. It seems to have vanished, or is...
Nope. We are still committed and focused on Plane Tree. It is the core of who we are. It is our history. It merges very nicely into the mission and values of Adventist Health. And so we're working through what that looks like in the future. but we are still 100% committed to the Plane Tree culture. We might not be Plane Tree certified, which we're not right now, but we are still on a mission to get recertified and to continue to focus on that Plane Tree foundational. It is who we are, and it'll always be who we are.
Thank you,
Jayme,
because
I'll
that's
have
been
a
a question
follow-up.
that's out there. Yeah.
Yeah.
Roger, if I may, I'll follow-up question on that one, and having kind of observed Plane Tree's evolution over the past
Yeah.
30 years, Plane Tree never secured the term patient-centered care. And as an organization, I think Plane Tree seems to be kind of diminishing nationally, but
Yeah.
the concept of patient-centered care has been integrated and is being integrated regardless of Plane Tree. It's that concept is still strong and fully alive.
Right. Well, it's our Patient Family Advisory Council, right? That is a huge piece of Plane Tree, getting thoughts, ideas from the people we serve on how we can make their experience better here in the hospital. It's keeping our public spaces very homey and comfortable. That will continue for us, and that will always be here. And then you are 100% right. This patient-centered care is integrated into a large majority of hospitals and healthcare systems across the nation. It's just Plane Tree is really a special designation for us, was and continues to be into the future for us. We did a site visit. The executive team went down to Columbia Memorial. They are a Plane Tree hospital. They are a critical access hospital, and had a really great conversation with them. And they continue to be Plane Tree certified and focused on that patient-centered care. And so into the future, now that we're critical access, and once we get our feet under us financially and quit losing the money that we have in the past, I really want us to refocus on Plane Tree designation, because I think it's special for the community and our patients and families, and our staff. They feel very strongly about patient-centered care. Yes.
Just want to add one more thing. I think some of you know I've had a long affiliation with Plane Tree.
Mhm.
And I also served on the Mid-Columbia Medical Center board at the time that we were looking for a partner. And one of the reasons that we chose to partner with Adventist Health is because their mission and their values so perfectly aligned with our Plane Tree Foundation and our commitment to patient-centered care. So I think that we don't talk about it as much in terms of it being Plane Tree, but I would say, as someone who's not only on the board, but serves on I think at least three different hospital committees, it is alive and well, especially if you talk with our staff. So I just want to throw that out there.
Roger.
I'm sorry, I don't want to monopolize. Got two more questions, and I think I want to get all this stuff out because, again, this is important. One, what's going to happen to Hood River down by the waterfront there? Is that still in play? Going to be down long range?
No, what we realized is patients were driving through the Dalles to go to our Nichols Landing building in Hood River to get care, and that just doesn't make sense. So we're pulling those clinics back, cardiology and orthopedics, and neurology, back to our main buildings here in the Dalles, and we will be subleasing that space. We can't get out of the lease, but we're going to be subleasing that space to another agency and get out of it, because we don't need to be in the Hood River market right now. We need to focus on where we are.
Thank you. That makes a lot of sense. And one final really hard one, and I know you can't comment on this, but I want to express my extreme disappointment for the sudden discharge of Dr. Reardon, who had just finished my second knee surgery. And but I know it had to be that way because if it's a retirement, then we get a letter in advance and all that stuff. Because it was, again, I know you can't say, but that hurt a lot of people.
Yeah,
So just so you know, he was very highly regarded.
yeah, yeah, we recognize, it was not easy.
Yeah, I understand that.
I just remind everybody, there's always two sides to every story.
I
So,
understand.
very
Thank you.
excited. Yeah, you're welcome. Very excited to have Dr. Gigante joining our team. I think he'll be amazing. He is the only one in the gorge that will do an anterior approach for hips. He is also trained on robotics, and most of his joint surgeries go home the same day. So it'll be nice to have him join our team. I think he'll bring a lot of value, and I'm excited. Thank you. And congratulations on your commissioner role. We probably do need to connect because I worked with Phil a lot. And I'd love to connect with you.
No problem. Happy to do so.
Okay.
Lee, I think I saw your hand go up.
Yeah, and thank you, Jayme, for this wonderful information, and congratulations on the critical care designation. That's fantastic. I just wanted to see if this was a trend, but when my wife was having emergency surgery at the hospital, it struck me that about 95% of the people we saw at the hospital were women. And then I went downstairs to get my breakfast burrito, which I was told it's the most famous dish in the Dalles, really. But I saw your photo on the wall, and I thought, is this a trend? Are more rural hospitals being run by women and staffed? If so, I think it's great.
Well, thank you. I don't think it's a trend.
Okay.
I would like to see more women in leadership roles. It still feels very male dominant in leadership, especially executive leadership. But as far as, I mean, here you have to be a good person. Doesn't matter if you're male or female. And you have to be committed to the community. We have a very diverse leadership team. But I do not feel like it's a trend across.
Okay. Thanks for that.
And we do have fantastic breakfast burritos for those that don't know. They're amazing, and our homemade salsa is top notch. That's the best part about it.
Scott, you have your hand raised.
Just a couple of comments. One is the benefit, I think, what I really appreciate is that you came up through the ranks, so you understand how it works on the ground and can be empathetic and understanding of those issues that come before the board. And while someone, whether male or female, who does not do that may be at a disadvantage. The second thing is that I had a comment the other day. My wife heard that this woman was in emergency and had fantastic service, and that was unusual. Usually, when I hear people talk about the hospitals, always generally talking about, well, I had this experience in an emergency room. And you've talked about this before, but any future plans for the emergency room?
Yes. Yes, our emergency department in the last 3 months have had the highest patient experience scores that we've ever had in the entire history of this hospital. So they have an amazing leadership team that is doing some, both physician and nurse leadership team. They're doing some great work on throughput to get you in faster, seen faster, decisions faster, discharged or admitted faster. So they're doing a really great job on that. There's also, we have rounding responsibilities, both on the inpatient and on the ED side. So leadership actually rounds with every single patient to find out about their patient experience, get immediate feedback, allows us the ability to do some correction and some work before the patient leaves if there's anything that they have a complaint or an issue with. So they've done some really great work, and we've heard really great things from the community in regards to their experience in the emergency department. Yes, with the ED, I would love in the next 5 years to do an emergency department expansion project. Again, it depends on how we do in this critical access and getting our feet under us so that we have the capital to expand the emergency department. But I would love to see a larger emergency department with more private rooms. Right now, it is basically, for those who know the ED, it's a fishbowl. You can hear and everything that is happening at the nurse's station and within the patient room. So really creating an ED space that is a little more private, a little more up with the times. Our ED is old and definitely needs some work. So that is on the wish list, and I'm really hoping we can get ourselves turned around so that we can put some capital into that project in the future.
Thank you, Jayme. Bill, you have your hand up.
I do. Really quickly, there was so much conversations many moons ago about the hospital wanting to build a new campus. And I know that's probably passed, but it does reflect on what's happened to the building over the years, is that it's somewhat was neglected. I presume that maybe you've got some plans to sort of refresh things and make that a little bit more accessible. The other question I have really is about how AI is working in with, is it seen as a benefit to being able to serve the patients, or as a detriment? Or I mean, how is that? How do you see AI in the process? Thanks.
So as far as the building, yes, there was plans to rebuild a different hospital several years ago. The reality is, with healthcare, there is no way we can afford a hospital right now at, I don't know, $200 million, $300 million, whatever it would cost for us to build. It's very expensive. So we really need to focus on improving this current building. And yeah, there are issues and things that have happened, but the problem has been in the past is that nothing, the can was kicked down the road and not taken care of at the time. So we're really working on fixing the things that come up so that no Band-Aid situations. We just put a Band-Aid over it and move on. We're really trying to fix it and do it right the first time. So we're working on that. Our facilities team is working on that. We're committed to that. And taking care of things quickly for patient safety and quality of care. So that is a core focus. The building and the infrastructure is old, but it's not that old. And we can make this space really nice between painting the exterior, which is on our project list, converting some rooms to single patient rooms upstairs so we have more private rooms for patients is not a big project. We've already done a lot of work on the flooring and the interior painting. We have a lovely mission wall now. Our signage has all been updated. So there are things we just have to slowly kind of check off the list. So we're here, we're staying here. No plans to build a new building anytime soon. And then as far as AI goes, yes, AI is all of the tools that we will have with our new Epic will be extremely beneficial for our physicians and our nurses and our patients. The ability to come into a patient room and say, do I have your permission to turn my AI on so we can have a conversation in regards to your care? Patient says yes, they're allowed, they do something on their cell phone, and all of a sudden it starts pulling together the conversation. So your nurse or your doctor is sitting having a conversation with you while it's creating your chart. the AI in the background creates that chart. So these are opportunities for increased efficiency, increased staff satisfaction, right? They're not having to sit on the computer forever. And then also patient satisfaction, because you get that face time and that relationship building with those physicians and nurses that are caring for you. So I'm very excited. I don't know about all the tools our new Epic has with AI. I'm told there's some AI capabilities in our CT and our MRI space that allows to pick up things quicker, pre-stroke type of situations. So I'm very excited. I think this is going to be a huge step forward for our organization and technology. And I think the community is going to feel it. So very excited. Thank you, Bill.
Can I comment on that,
Yeah.
Jayme? So in some of our outpatient clinics, we're already using AI to scribe that interaction with the patient. And just in my own experience and talking to some of our different docs, they love it because charting takes up a lot of time. A lot of them chart from home after they've worked all day. So it's giving them some, quality of lifetime back, but also the AI chart isn't really complete until the physician reviews it and makes sure it's accurate, and then they sign off on it. So it isn't like, this robot is going to make stuff up about you.
Right. Yes, the physician, and same for nursing. They have to go in and review all of it, make edits, and approve it, and then it uploads into the chart. But it's a fantastic tool that we would never have if we weren't a part of Adventist. So very excited to see what it looks like as we move forward.
We're winding down to the hour. Roger?
One quick one. You mentioned you finally got this final designation. When
Yeah.
does the billing switch over so you're able to do the billing, we get to higher recompensation from the government?
The billing will change over as soon as we get our, we're working on, this is all crazy and convoluted. There's a lot to it, but we're working with Noridian, which is our carrier for payer CMS payers. So we're working with them to transition. They have to do some work on their side to transition to method 2 billing. I don't foresee it really happening until after we go live with the new Epic, because it's built, the background work's built in our new Epic with Adventist Health August 30th. So I don't see any of that truly happening until after August 30th, and that build is complete and we can move forward with the method 2 billing. There's a lot to it. It's very.
I think we'll all be greatly relieved to get some more money coming in. Thank you.
I know. We are. Yeah, we are. And like I said, we're very thankful we got critical access. It's not, it's not, there are still other things that we have to do to get our feet under us, but it is definitely a huge chunk of where we need to be.
It's always difficult for an organization, whether it's a hospital, a college, a city, a county, to talk publicly about financial challenges.
Yeah.
And we tend to not talk about that. But at the same time, when we fail to do so, we kind of give people the assumption, well, everything's fine up there.
Yeah.
I'm looking at Becker's hospital review, which Michelle introduced me to. And the headline this morning was 700 rural hospitals are closing across the United States. So you have dodged a bullet with this, the partnership over the past year here, and the community doesn't know how close we all came to losing that. Michelle, your cell phone is going off. Before we close, as we close at the hour, I put a plug in for One Community Health Foundation. I'm on that board, and we have a foundation launch coming up on the 14th. There's a QR code there. Please take a look at it. You would be welcome to join us. I hope you see us in White Salmon for that launch on the 14th. Our guest this morning has been Jayme Thompson on the
You can call me
Oh,
whatever.
fond members of Judge Gary Thompson, Sherman County. Jayme.
Oh, thank you. Yeah, I put my email and cell phone in the chat as well. It was a pleasure. Thank you for inviting me. I'm happy. My door is always open. I take phone calls, emails. If you guys have questions or rumors in the community, if you want me to talk at different community events, I'm more than happy to participate. So do not hesitate to reach out.
Thank you so much, Jayme, for taking time this morning from a busy schedule. We
Thank
wish you
you.
well. Good luck with
Thank
everything you're
you.
doing.
Thank you. Appreciate it.
Okay.
Thank you.